As people age, they become more susceptible to disease and disability. That's why healthcare professionals say having insurance is key to prevention and for treatment.
And the Now KC's Tara Hall with how one area health center is working hard to spread the word across the Kansas City metro.
Retiring early is something many working Americans dream of. But for Amelia Bonds Ingram, the decision to retire before 65 came with a new set of problems.
I just did not have money to afford health care. I'm not quite old enough yet for Medicare. So I was in that gap that comes sometimes between being 60 and being 65. And if you can't afford your own health care coverage, you just end up without.
For 3 years, the 63-year-old went without annual screenings that could have caught a whole host of ailments that affect people as they age.
It's kind of scary, especially as we do get older, when you can't even do basic maintenance or routine for your own health.
But in December, that all changed when she decided to give herself an early Christmas present, the gift of health insurance through the Affordable Care Act.
To have it now, it is immeasurably comforting to know that if I needed to go to the hospital, I could go. You can pay for a lot of things, but you cannot get health once it's gone.
An ounce of prevention is worth a pound of cure.
Dr. Sudeep Ross, the chief health officer at the Samuel Rogers Health Center in Northeast Kansas City, says since ACA was enacted, he's seen preventive care visits at his clinic nearly double, from 5,700 in 2013 to 10,000 in 2015.
When you don't have insurance, it's like you don't know what you don't know. And so that's why I remain hopeful that the Affordable Care Act is drawing people in to have health insurance so that we can do those checkups and diagnose things early and make them healthier.
One of the mistakes that Dr. Sudeep Ross says that opponents and proponents of the American Care Act make is asking, is it working yet? He says we still need several more years of enrollment before we can come to any truthful conclusions.